Welcome to my office in Cambridge. This is Professor Alan Barrell, and it's my great privilege today to discuss with you this wonderful subject, the future of digital healthcare, which was first presented just a little while ago at the Beyond the Internet of Things conference online. And I have some observations and reflections from our base in Cambridge, and I want to make it clear at the outset that I'm not simply presenting my own work here. This is the work of many people, and I'm honored to be able to present it. It's our latest thoughts on where this amazing subject of digital healthcare is going. And I'll start by saying that the future of healthcare will be digital. The evolution of new connectedness in the world is wonderful, and some would say that we are in the process of revolution. So we'll have a look today at the Internet of Things platform, which of course is our launchpad for the future. Challenges indeed for the healthcare systems of the world, all about people, health, wellness, the complete supply chain of healthcare and digital engagement is something we just want to touch on because digital healthcare embraces everything in healthcare. And we'll talk about research, development, diagnosis, therapeutics, and healthcare mindset. And we will also explore the impacts of artificial intelligence and machine learning and how bioinformatics and big data are moving ahead. And I've got some thoughts towards the end of the talk about how COVID-19 has actually, a terrible thing though it is, contributed to aspects of how we respond and can respond to pandemics through digital healthcare. Now, let's begin at the beginning. That's a good place to begin, isn't it? And we begin with this man. Let's just have a few thoughts about the platform that we call the Internet of Things and where it all began, because it began with Tim Berners-Lee, the father of the digital age and this era in which we're living. Because internet enablement has really been why we are where we are today. And it's the platform not only on what we're doing today, but where we're going in the future. And we won't get too technical about this, but the reality is that in the relatively short number of years since the mid-80s, we've seen amazing progress in the way in which we can handle data and communicate due to the digital revolution. It has been quite astonishing. And we talk today, don't we, about the Internet of Things. It's here, it's the Internet of everything. It's the Internet of anywhere, the Internet of the industrial world, the machine-to-machine Internet, where machines can talk to each other. It's the Internet of sensing, and it's the Internet of consciousness. But beyond the Internet of Things we have today, health, healthcare, and wellness across the board is going to be impacted very, very significantly, all the way through prevention, diagnostic, treatment, and we'll have a look at that. Just a quick reminder, the Internet of Things is technical, but not too complicated. It's all about short and long range wireless networks, which connect things up and enable information to be communicated very, very effectively between us. And of course, it doesn't only happen in a terrestrial sense because it's happening in the cloud. And we all know there are many, many apps out there today. And I often think of the Internet of Things as connecting up our planet through informing, through storing, through processes, decisions. It helps us to take action. And indeed, the Internet, in a sense, is a brain, isn't it? It's a storage of information and consciousness, all the way from things to people to animals to the environment and into machines. I want to mention and give credit here to some of the companies that are really doing an amazing job in enabling the Internet of Things. And one of them, a Cambridge company, which makes me very proud as a Cambridge man, is Arm Holding. a company that is really strong in connecting things up through the microchips that it develops. 150 billion of them around the world today having been designed by ARM. And it really is contributing to the digital healthcare age. We couldn't do without these sensors and these chips. Now let's focus for a moment on the big challenges for healthcare and wellness. The world population is growing very fast, and we're all getting older. We are not all getting healthier as we get older. We'll have a look at some statistics on that in a moment. So there is a very major role for digital healthcare, helping us to know how we might accelerate progress when we think about the adoption and diffusion of innovation and new technology. How do we join things up more effectively? Let's remind ourselves also that medicine, certainly in the developing world, is changing. And beyond where we are today, when we look ahead, it's moving progressively from hierarchical organization to networks where more and more people will be involved. This diagram was given to me by Dr. Robert Winter, who was the director of research in our healthcare center in Cambridge some years ago. So we will be dependent to make all this work on connectedness. So if we think of it in a practical sense, here are all the elements that we can think of related to healthcare in a community: the patient, the pharmacy, the doctor, the social services, the commercial sector, local government, schools and colleges. If they can all be connected up in a two-way sense, we can make a lot more sense of healthcare. The third sector there is charities, because they're important too. And as we look ahead to the future of healthcare, we would agree, I think, that we can't go on building more and bigger hospitals, that as we all do grow older and hopefully a bit healthier, then cost-effective healthcare will happen more in the home and in the community. It will be supported healthcare. And maybe we will have a little card that has all of our healthcare information on it, but there may be other ways that we communicate. But there is an imperative of driving digital healthcare in order that we can connect things up and make this new world of supported self-care work. So in the hospital, managers will be able to use infection control information and bed management data in order to do things better. Devices that capture our health data can be connected up more effectively, and healthcare records can be shared between all the people that need to have it. Connecting and communicating for good health will be enormously important. There's an example here which shows us, concerned with two of the things I've mentioned already, how healthcare systems are changing and how information is so important. From Finland, we can see how the systems are being developed there with digital solutions that deal with home care, nutrition, biobanks, neurocenters, patients and managers being connected up together. There is, of course, a question that relates to healthcare information, mine and yours. Who owns it? And who has the right to manage it and move it around? Important ethical questions, aren't they? I don't have all the answers. As seen in Finland, there are all of these elements represented on the slide here: the patient records, data from specimens, genomics and genetics becoming very important. And we're concerned, aren't we, with early detection, well-being, health improvement, self-care, diagnostics, and we can look even further: decision support systems, social media, big data, biobanks. So the software industry playing a big part. And the games industry too. Games for health is quite important too. And the names are coming on here of some of the companies in Finland that are already involved. So we can see a composite picture here where digital technology is connecting all of these things up. So the future of healthcare really needs the ongoing development of digital technology. And there should be a lot of incentive for companies to get involved because the market is going to be very healthy and big. This is an interesting picture that I'd like you to think about, taking us back a step to the technologies that are involved in all aspects of healthcare from research onwards. Technology platforms, biotechnology, information technology, nanotechnology, and within all those circles, there are things that are very important, as I think you will agree, on medical research, on medical treatment, on diagnostics, on therapeutics. And we can also say that in a world where communication is so good, open innovation and the sharing of information between people working in these different disciplines is so important in enabling innovation. Because where people work together across these technology borders, we see the transfer of tacit knowledge. We couldn't do the genetics and genomics that we do today with our amazing computers. And of course, we have entrepreneurs around, people that think about how all of these things can be put together. And with the Internet of Things available, entrepreneurs are doing astonishing things to make healthcare a different area. Now, whilst we're on the subject of medicine, let's also remember that we're moving away from the era of blockbuster drugs and where groups of people were thought of and being treated together towards that point at the top of the staircase of personalized medicine. And all of the things on this slide are going to be very important if we're going to get to that top step where individuals can really have individualized healthcare. And data and communications are going to be very critical to enable these developments. And then in the medical devices area, where so many new things are being developed and they're becoming more sophisticated, machine-to-machine contact is happening. And regulatory issues are being evolved in order that the new technology can be brought to market more rapidly. But in these areas as well, communications and connectivity are very critical. So when we look at the medtech industry, and here are the main elements of it: biotech, engineering, electronics, digital communication and connectedness, connecting up not just the companies, but the individuals and the researchers in all of those circles is going to be astonishingly important. Don't worry too much about the numbers of pictures on this slide. I'm looking here at how we treat health and disease, all the way from people that are healthy, where we want to prevent them from getting sick, to the worried well, people who are concerned, they might not be sick, but they think they might be, to the real sick, to those we want to cure, and to the aging people who are an increasing part of the population. And we can think about diet, we can think about pharmaceuticals, we can think about complicated stuff like gene therapy, bionics, and things that maybe don't exist yet today. The therapeutic approaches to disease and prevention of disease. And on all of those points in this map, digital activity will be critical in the future. I spoke earlier about the way in which the world population is growing, and we can see on this chart how dramatic it is. 7.5 billion of us here today, growing to over 11. And look at the rate of growth in the 20th century of the world's population. And in the other chart, we see how that's leading to many more people growing older, but it's also leading to different points at lifestyle where we might need to think differently about health, and not only health, but the money we invest in it. 70% of health expenditure is absorbed by long-term care. People that won't get better, but they're going to live some point in time and they're going to need caring for. And in certainly the UK, 70% of our health budget goes in that sector. And the cost of care, if we look at the different areas of healthcare, in acute hospitals, of course, it's very expensive, and residential care is expensive. But the further we move towards personal and home healthcare, the more perhaps we can reduce the cost and make better use of the money. So this is another argument for what I was discussing earlier about the need for more care in the community and in the home. And it should lead, shouldn't it, to an improved quality of life, because it is better to be at home and in the community than in a hospital bed. Looking here at advanced Internet of Things enablement of clinicians, what is it doing for the doctors? And there are some things listed on here that you can read: the automated image diagnosis, virtual nursing assistants, not all real people, robot assisted surgery, connected machines. And we put on the slide the value of some of the markets that are emerging for industry to provide doctors and nurses with much more assistance. And it's a pretty big market that's growing here. And we see artificial intelligence and machine learning providing more and more help for clinicians, nurses, and paramedics. The total value of this market for industry might be as much as 150 billion. And the artificial intelligence market alone is growing very rapidly, something like 11% in the few short years mentioned in that yellow box. Let's think about how digital technology is enabling and supporting progress towards what I mentioned earlier: personal precision medicine. The Human Genome Project has been amazing. Epigenetics is contributing enormously. And the more we know about genetics, the more we know about microbes and the microbial genomes, the more we know about personal behavior, the more we can determine what might be valuable to individuals. And wearables and ingestibles that give us from each of our bodies information that can be fed into those processes that are determining our personal health and our personal treatment plan is going to be very important. And that is digital healthcare. And one of the examples that I am very close to at the moment is the use of very, very advanced system of identifying sepsis very early and actually identifying the organisms that are causing the infection using DNA profiling. And that can be done by digital health systems, a wonderful array card system that enables a sample to be used and within 4 or 5 hours to show which bugs are actually affecting the patient, if there are any there. And this, of course, compares with previously what would take in the laboratory possibly 4 or 5 days. So digital healthcare contributing dramatically. And in the management of health data, artificial intelligence is absolutely essential. Look at the amount of data that is being generated from hospitals and health systems around the world. And 80% of it is unstructured. Massive amounts of diverse patient data streaming through sensors and monitors and instruments and being recorded. And our ability to analyze big data can only be adequate if artificial intelligence and machine learning are further and further developed. So patient data collection is very, very much a very interesting and big field. And we're looking here beyond IoT and healthcare, the challenge that we have of making sense and good use of the flow of all this information. I can't read all of those items on the slide. You can have the slides to look at it all in detail afterwards. But think of all the inputs that are providing lots and lots of masses of new data, big data, going into the world's medical literature and into doctors' offices every day. And then think about the challenge of how we convert that input into output that is really usable information that can be helpful to doctors and patients. We can only do it with digital technology. And again, the challenges of adopting artificial intelligence are listed on this slide. We have to humanize the data, which is not always easy. And people worry a lot, don't they, about big data? They don't always believe it. So there are technical limitations about what we can do with data, and there are medical limitations too about how we can use it. And that includes some very big ethical challenges. But what artificial intelligence has already done for medicine is actually dramatic. I'm listing only some of the things that we can take note of here. If you look at them, and do take the slides away and examine them afterwards, in the fields of diagnostics, medical imaging, predictive medicine and therapies, administrative functions, in patient-centric healthcare, AI is enabling doctors, nurses, and other medical workers to be so much more informed and also effective. And then if we think of the Internet of Things and wearables and the impact of the Internet and wearables on healthcare, we can get some good ideas from this chart about the many, many things that are now being measured on the patient and recorded and forwarded onwards through IoT into the cloud, out of the cloud, back down to the doctor, to the paramedic, or whoever else might need the information and make good use of it. This is the world of almost today, and certainly the world of tomorrow. There's a couple more examples here of wearables. There is a big industry now developing in games for health. Why not? Why not make the care of my health and the management of my health information something which is not just depressing, but which I can actually use to get my spirits up? And there are many, many, many games now being developed to help people, including children, cope with their healthcare. And of course, we all know, and then we know it for sure if we go to the gym, wearables and fitness monitoring is a very, very big thing indeed. And medtech and the long tradition of the wireless industry developing things we can wear that help us monitor our physical state is very, very big indeed. Now, where will healthcare big data be generated in the future? More and more, I think, in retail outlets. There'll be more and more software. We'll have a lot more information from patient registries. There'll be a lot to do with pay for healthcare, with insurance, and there'll be an enormous amount of data coming from mobile data that will be of interest to insurance companies. So there is a big future in other uses of digital healthcare. Now, this slide looks a bit busy, but don't worry too much about it. What we're showing here is the exponential growth in computing power over a period from 1900 to where we might be in a few years' time. That's the red graph. And the pictures are pictures of different devices. There's Charles Babbage's 1880 difference machine. Of course, that wasn't digital, but it worked very well. It was a great calculator. And then through the computer industry, the BBC Micro, through mainframes and other computers, we see how computer science has developed enormously rapidly. And if we think of it in terms of brain power, comparing computers to the brain of either animals or people, just look up in the right-hand corner there where it said that by 2015, computer power had surpassed the manpower, the brain power of a mouse, and that by 2023, it will reach human proportions. And it says, the theory at least, or the predictions tell us that by 2045, the power of computers will have surpassed the power of all human brains. Whether we believe that, I'm not sure, but we do have to believe that computer power is pretty mighty these days. And Professor Chris Lowe's people in Cambridge gave me this statistic. The computing technology is now progressing more each hour than it did in its entire first 90 years. So big data, amazing possibilities, but lots of challenges because the volume is great, the velocity is getting ever faster, the variety is increasing, and the veracity needs testing. It isn't all good data. It isn't all usable data. There are big challenges, and that's why we need such powerful computers. The blockchain is something that most people relate to finance. They think of it in terms of the Bitcoin and currency. But blockchain technology, many of us believe, will play a very, very big part beyond Bitcoin because it is an extremely interesting and secure way of analyzing and dealing with data. And there are just a few of the possible applications of blockchain listed on the slide here. So watch blockchain for the future. Beyond the Internet of Things, we have a lot to learn, and most of us are still learning. Analyzing, machine learning, big data. Where is the future taking us? Let me go back to a picture I showed you a little bit earlier and put a little bit more detail on this slide. We looked at the healthy, the worried, well, the sick, and the chronically ill. And just a few more things where digital healthcare is going to make a big impact here. Genome interpretation. In rare diseases, actually understanding genomics at a very early stage might make all the difference between being able to deal with that particular rare disease. And there are those people, of course, who are worried, and we might be able to help them if we can give them more information to show that maybe they don't need to. And with the sick people and chronic illness, all sorts of things that are coming through the pipeline that are powered by digital communication. In IVF, in autism, drug discovery, just a few of the things listed here where with imagination we can see AI progressively impacting across the human lifespan. I was thinking this morning, listening to another talk about digital healthcare in China, just as an example of how a nation can be influenced. And there are some lessons in China for the rest of the world. How artificial intelligence and machine learning is enabling China to make leaps and bounds in provision of healthcare relative to its own particular health system of the moment. The improvement in public understanding and wellness and health in China has been very, very significant. And there's an amazing company called Ding Chang Doctor that does lots of work on artificial intelligence, working with the public and with doctors on healthcare provision of information. And there is a triage system now in place to enable scarce clinical resources to focus on those patients with real needs. So because more and more patients are getting information online about their health situation, and because there are so few doctors in China, look at that statistic, 1.8 doctors per 1,000 citizens in China compared to 6.8 in my country, the UK. And in China, there isn't the same kind of general practice system that we enjoy here. So the use of online information and education and engagement of the public is really a big thing for the future of Chinese healthcare. And I heard recently from a colleague in China that wearables, especially in the remote parts of China, and proper consultation and greater trust with doctors online is leading to a much better understanding of health, wellness, and how it can be coped with in that country of 1.4 billion people. And in China, the insurance industry is playing a very large part in bringing together the issues of the patient, the doctor, and the funders. Now, I want to come to the conclusion here by looking at where we are today, the year of the virus, the horrible year of the virus. The pandemic did bring crisis and disruption in the world, tragic human loss. But it has also transformed lots of ways in which we think. And it has supported improvement in processes that are bringing healthcare closer. So COVID-19 devastated health systems around the world and economies as well. But digital healthcare has enabled all sorts of things to be developed quickly, such as, in the case of COVID-19, test, track and trace systems driven by digital healthcare. And if we look at countries like Taiwan and New Zealand, they use the track and trace systems in order to control the pandemic and suffered so much less loss of life than other countries that didn't all get it right. It was well done in a number of countries and has still to be better done in others. But it was an example of how digital healthcare has helped with the pandemic. And let's not forget that we've seen a revolution in the development of vaccines in recent months. Revolutionary speed with which vaccines have been developed, less than a year for a major new disease such as COVID-19. And a lot of that development has been driven by in silico work that we can definitely regard as digital. And science, we could say, has brought the future here today. So just to wrap up and think about where change is occurring in digital healthcare terms and why digital healthcare is so important. If we look at the list of the ways in which traditionally we've handled our healthcare through hospitals, through hierarchy, through institutions, through authority, where there's been an ivory tower of knowledge, and we look ahead to future medicine, much more in the home and the workplace, we look forward to partnerships instead of hierarchy, and where institutions are not just bureaucratic operations, but really do deal with human people who are the patients, where the medical profession becomes as much a guide and a partner as just the predictor and the great expert on everything. And that ivory tower of knowledge is broken down by social media being able to communicate to so many of us what we need to know about our health. And the future of medicine, most people agree, is going to become much more personalized. And that means we have to understand more about information, and the digital health revolution will contribute dramatically to that. This is the picture of one of the educational aspects of digital healthcare, just to mention another area of great development. This is in Imperial College in London today, and it's an amazing technology that enables perhaps anatomy and physiology to be taught in different ways than they have been taught traditionally. Now, having said so much about so many complicated things, I wanted to bring us down to earth at the end here and just remind us that really so much of information that we need for our health is delivered today and will be delivered tomorrow in our pockets, in these cell phones. Our cell phones, when we look into them and speak into them, will be able to feed us back in no time at all, using artificial intelligence in the cloud, very, very many things about the condition of our body and our health. And digital healthcare will reduce timescales, it will reduce costs and anxiety, and it really will support wellness and better lives for many, many citizens of the planet. So, the convergence of technologies and digital healthcare is absolutely central to where healthcare goes in the future. Artificial intelligence, machine learning, and robotics are going to be very, very dominant. I'm very hopeful that the globalization of improved health and well-being will become achievable, and good health will be accessible to many more people in parts of the world where they simply don't get it today. And we have the potential for reimagining and reshaping the whole of the ways that we think about healthcare. We're going to see reductions in timescales from research and discovery as we've seen recently, there will be more and more of them, through translation to treatments and solutions, and that is going to be continuous. And costs of healthcare can be significantly reduced. So digital healthcare offers a future of unending discovery and health improvement. Imagination, as Einstein said, in some ways is more important than knowledge. Imagination and innovation will outweigh knowledge if we're going to optimize what we can do with healthcare. So I thank you sincerely for traveling with me on this journey. I wish you well, and I wish you good health. Thank you.